Hi everyone, my name is Courtney Freeman, and today I'll be addressing healthcare worker burnout. The reason I chose this topic is because I think it's important to understand the effects of healthcare worker burnout, especially as a future healthcare administrator and having worked in the healthcare field previously. I have a firsthand account of how burnout can impact employee performance and make the job less desirable. Burnout's become a significant issue impacting the healthcare industry, especially in the aftermath of the COVID-19 pandemic. Symptoms of burnout were reported by 50% of respondents in a recent survey, with 56% of these respondents being nurses. Understanding these causes behind worker burnout is the only way to seek change and improvement in worker conditions. It's vital to minimize healthcare worker burnout so that there is less hospital turnover, thus increasing the patient experience and leading to better health outcomes. The purpose of this presentation is to highlight the significance of healthcare worker burnout, an aspect that is important to focus on for both the healthcare worker's sake and the quality of patient care. Today, we'll be overviewing the causes and impacts of healthcare worker burnout, along with the effects of this burnout on patient safety and care quality. It will also include a possible solution using mindfulness programs to combat healthcare worker burnout, and then finally address implementation using the Plan, Do, Check PDCA model. Burnout has become a widespread crisis that's affected not only the mental state of healthcare employees, but has also led to increased medical errors. Imagine being responsible for the lives of others, yet feeling so physically and emotionally drained that you can barely function. This is the reality that healthcare workers face today. Addressing the needs of these healthcare workers is not only essential for their well-being, but for the patients that they treat. Reducing this burnout will improve the quality of care. But how do we reduce this burnout? As future healthcare administrators, it's important to first understand the causes. The increasing demands for healthcare workers put pressure on their mental health, leading to not only physical, but also mental exhaustion among staff. These demands came to a head in the aftermath of the COVID-19 pandemic. A cross-sectional online survey demonstrated that higher cases of COVID-19 contributed to stress and burnout. The overflow of patient and staffing needs, along with changing responsibility, most likely started that rapid mental health decline. Overworked staff are more likely to make errors in treating the patient. These issues extend beyond the pandemic, with increased medical errors affecting patient outcomes. This demonstrates that action needs to be taken to mitigate this burnout. Patient outcomes suffer when healthcare workers are too emotionally exhausted and hospitals are understaffed due to turnover rates. Addressing healthcare worker burnout is a target that could improve the healthcare system overall. In recent years, the escalated burnout among healthcare workers is more than likely a result of increased stress that was spearheaded by the COVID-19 pandemic. While the worst of the pandemic may be over now, there is still a lasting impact on healthcare workers, which calls for intervention measures that can be taken to counter the rise in burnout. Now that there's an established understanding of factors contributing to this burnout, the next step is to explore strategies that can counter the issue to improve healthcare worker mental health and the quality of care provided to patients. Many think that the solution to healthcare worker burnout is for the healthcare workers themselves to learn coping mechanisms to ease stress. While these methods may work in the short term, they are not useful for long-term solutions. Figure 1 on YouTube highlights some strategies that employees could implement to ease workplace stress, such as allowing employees to have input on their schedules and ensuring that the workplace is always organized and stocked with supplies. The solution I would recommend is a mindfulness program. But first, I would use a force field analysis to identify the driving and restraining forces for implementing a mindfulness program. A force field analysis can also determine if the mindfulness program is likely to succeed. The force field analysis would consider potential obstacles and use driving and restraining forces to overall help administrators design an action plan rather than suggesting a solution. We could use driving forces such as reduced turnover costs, improved patient satisfaction, better staff mental health as the supporting factors for the mindfulness program, while also addressing restraining forces such as the cost of implementing the mindfulness program, lack of staff engagement, and time constraints due to healthcare workers' hectic schedules. Now that we've discussed a potential solution in addressing healthcare worker burnout, let's focus on the implementation of the solution using a structured framework. One widely used framework for continuous quality improvement in healthcare is the Plan, Do, Check, Act cycle. There are 4 steps within the cycle: planning, doing, checking, and acting. Walking through our application of the PDCA cycle to address healthcare worker burnout starts with our plan, which is to design the mindfulness program, set goals, and design the schedule. You can also find resources and address potential challenges. The next would be to do, we would start the program with a small group of 10 to 15 healthcare workers from different departments, such as nurses, physicians, and technicians to test it. This would allow for different perspectives. The program would run for 6 weeks, which allows for enough time to test engagement and the effectiveness of the program. The participants will attend weekly mindfulness sessions and track their stress levels using pre and post session surveys. Third, we would monitor the effectiveness of the solutions by collecting feedback through surveys and staff engagement. Lastly, would be to act, and that would be to adjust the program according to feedback from staff and improve based on the results. Because of its thorough structure, using the PDCA cycle is an effective way to ensure proper implementation of the mindfulness program. It's also a simple structure, which means that it can be used across different healthcare settings. Based on these findings, we can see that burnout is a serious and sometimes overlooked issue facing healthcare workers across the board. As future healthcare administrators, we need to start focusing more on the impacts of healthcare worker burnout so that we not only increase the well-being of these healthcare workers, but also increase patient satisfaction and the prevention of medical errors. It's our job to find and implement these solutions, such as the force field analysis and PDCA cycle, to create a lasting impact that will change the trend we are currently on. Prioritizing intervention programs like mindfulness programs could reduce healthcare worker burnout and improve patient care. Healthcare workers play a large role in taking care of the people in our society. It's time we started taking care of them too. And then lastly, I just have my references here. And thank you for joining.